Sarah Martinez had never imagined that being overlooked would become her greatest strength. At 28, she had spent the last 3 years bouncing between hospitals as a temporary nurse, filling gaps in understaffed wards across the city. While permanent staff often treated her like an outsider, Sarah had developed something invaluable through her constant movement between facilities, an eye for details that others missed. The morning of October 15th started like any other at Metropolitan General Hospital. Sarah arrived at 6:45 a.m. for her 3-week assignment in the cardiac intensive care unit. The night shift nurse, looking exhausted after a 12-hour stretch, barely looked up as she handed over the patient charts. Room 314 needs vitals every hour, 318 is post-surgery and stable, and 322 just came in with chest pains, the nurse rattled off mechanically. The permanent staff will be in at 7. Just keep things running until then. Sarah nodded, accustomed to being treated as temporary help rather than a qualified professional with 5 years of nursing experience. She had learned early in her temp career that proving herself took time, and some staff never bothered to learn her name before she moved on to the next assignment. The ICU was quieter than usual for a Monday morning. Only 8 of the 12 rooms were occupied, and the patients seemed stable. Sarah began her rounds, methodically checking each patient's condition and recording their vital signs. Her training had taught her that consistency in monitoring could mean the difference between catching a problem early and dealing with a medical emergency. In room 314, Mrs. Eleanor Thompson, a 73-year-old woman recovering from a heart attack, smiled weakly as Sarah entered. Despite her condition, Mrs. Thompson had maintained her sense of humor throughout her stay. "Another new face," Mrs. Thompson said softly. "They rotate you young nurses so fast, I can barely keep track of names." Sarah smiled warmly while wrapping the blood pressure cuff around Mrs. Thompson's arm. "I'm Sarah. I'll be here for a few weeks, so you'll be stuck with me for a while." That's refreshing. Most of the temporary staff act like they're just passing through. The comment struck Sarah more than she expected. Mrs. Thompson was right. Many temp nurses did treat their assignments as brief stops rather than opportunities to provide quality care. Sarah had always tried to be different, but she wondered if her efforts were noticed. As she recorded Mrs. Thompson's vitals, blood pressure 128/84, heart rate 72, oxygen saturation 97%, Sarah noticed something that made her pause. The numbers were all within normal ranges, but there was something about the woman's breathing pattern that seemed slightly off. It wasn't irregular enough to trigger alarms, but after years of monitoring patients, Sarah had developed an intuition for subtle changes. "Mrs. Thompson, how are you feeling this morning? Any discomfort or unusual sensations?" The elderly woman considered the question carefully. "Nothing specific, dear. Maybe a little more tired than yesterday, but the doctor said that's normal after what I've been through." Sarah made a note in the chart about Mrs. Thompson's fatigue and moved on to the next room. Room 318 housed James Morrison, a 45-year-old construction worker who had undergone emergency surgery to repair a damaged artery. He was awake and alert, though clearly uncomfortable. "Morning, Mr. Morrison. How's the pain level today?" "Better than yesterday, thanks to whatever they're giving me through this for. Though I'm getting pretty tired of being stuck in this bed." Sarah checked his surgical site and vitals, noting that everything appeared to be healing properly. His blood pressure was slightly elevated at 142/90, but still within acceptable post-surgical ranges. She adjusted his position to help with circulation and made sure his foreline was secure. Room 322 was her final stop on this floor. David Chun, a 38-year-old accountant, had been admitted the previous evening with chest pains that turned out to be stress-related rather than cardiac. He was scheduled for discharge later that morning, pending one final round of tests. "Looking forward to getting out of here?" Sarah asked as she prepared to take his vitals. "Absolutely. This whole experience has been a wake-up call about my stress levels, but I'm ready to get back to normal life. With some changes, of course." As Sarah wrapped the blood pressure cuff around Mr. Chin's arm, she noticed something unexpected. His heart rate, which had been consistently in the low 70s during the night, was now reading 58 beats per minute. For most people, this wouldn't be concerning, but for someone with Mr. Chin's medical history and current stress levels, it seemed unusual. "Mr. Chun, have you been feeling lightheaded or dizzy at all this morning?" "Now that you mention it, I did feel a little off when I stood up to use the bathroom about an hour ago. Thought it might just be from lying in bed too long. Sarah took his blood pressure reading twice to confirm the numbers. 118/76. Perfectly normal, but combined with the slower heart rate and his dizziness, it painted a picture that concerned her. She made detailed notes in his chart and decided to mention her observations to the attending physician when he made rounds. By 7:30 a.m., the permanent day shift had arrived. Dr. Patricia Williams, the attending cardiologist, was known for her thoroughness and no-nonsense approach. She had worked at Metropolitan General for 15 years and had seen countless temporary nurses come and go. Most lasted a few weeks and moved on without making much impression. "Good morning," Dr. Williams said as she approached the nurse's station where Sarah was organizing charts. "How did the night go?" Sarah presented her findings systematically, starting with the patients who were stable and progressing to her concerns about Mr. Chen's changing vitals. She also mentioned her observation about Mrs. Thompson's breathing pattern, though she acknowledged it might be nothing significant. Dr. Williams listened attentively, occasionally asking questions about specific measurements or timing. Sarah's detailed notes and precise observations impressed her. Many temporary staff provided only basic information during handoffs. "You said Mr. Chen's heart rate dropped from the 70s to 58 overnight." "Yes, and he reported feeling dizzy when standing. His blood pressure is normal, but the combination seems worth monitoring." "I agree. Let's keep a closer eye on him and run another EKG before discharge." "What about Mrs. Thompson?" Sarah hesitated, knowing her concern was based more on intuition than concrete symptoms. Her vitals are all normal, but something about her breathing pattern seemed different this morning. She's also reporting increased fatigue. Rather than dismissing Sarah's observation, Dr. Williams nodded thoughtfully. Post-cardiac event patients can have subtle changes that precede complications. Let's order another chest X-ray and blood work for her as well. Sarah felt a surge of professional validation. In many of her temporary positions, attending physicians had little patience for input from temp staff, especially when it involved subjective observations rather than clear symptoms. The morning progressed smoothly until around 10 a.m., when Sarah noticed an unfamiliar man in scrubs walking through the ICU. Healthcare facilities were usually bustling with staff from different departments, but something about this person caught her attention. He moved with purpose, but seemed to be studying room numbers rather than heading toward a specific patient. Sarah watched discreetly as the man stopped outside room 318, where Mr. Morrison was resting. The stranger appeared to check something on a clipboard before entering the room. Given that it wasn't time for scheduled medication rounds or routine procedures, Sarah found his presence curious. Hospital security protocols had been emphasized repeatedly during Sarah's orientation. Unauthorized access to patient rooms was a serious concern, particularly in intensive care units where patients were most vulnerable. While the man was wearing appropriate medical attire, Sarah had worked in enough facilities to recognize most of the regular staff within a few days. She approached room 318 casually, pretending to check supplies in the nearby storage closet. Through the partially open door, she could hear the stranger speaking to Mr. Morrison in low tones. The conversation seemed professional, but something felt wrong about the interaction. "Mr. Morrison, I need to check your 4 medication levels and make a small adjustment," the man was saying. "This will just take a moment." Sarah's training kicked in immediately. Medication adjustments in the ICU required specific protocols and documentation. Any changes to 4 medications needed to be ordered by the attending physician and verified by the nursing staff. The fact that she hadn't been informed of any scheduled medication changes raised immediate red flags. Without making her presence obvious, Sarah moved closer to observe what the stranger was doing. She could see him manipulating Mr. Morrison's 4-line, but from her angle, she couldn't determine exactly what substances he might be introducing into the system. Her heart rate increased as she realized she might be witnessing something dangerous. Hospital infiltration by individuals intent on harming patients was rare, but not unheard of. The thought that someone might be attempting to hurt Mr. Morrison or other patients under her care filled her with both fear and determination. Sarah quickly but quietly retreated to the nurse's station, where she could call security without alerting the stranger to her suspicions. Her hands trembled slightly as she reached for the phone, knowing that a false alarm could be embarrassing, but that failing to act on legitimate concerns could be catastrophic. Security, this is Sarah Martinez in the cardiac ICU, she whispered into the phone. I need someone up here immediately. There's an unauthorized individual in room 318 who appears to be manipulating a patient's 4 medications without proper protocols. The security dispatcher assured her that officers would be there within minutes and asked her to maintain visual contact with the suspect without confronting him directly. Sarah hung up and positioned herself where she could observe both room 318 and the main corridor leading to the ICU entrance. Through the doorway, she could see the stranger finishing whatever procedure he had been performing on Mr. Morrison's foreline. He appeared to be preparing to leave the room, and Sarah realized that security might not arrive in time to intercept him at Mr. Morrison's bedside. The next few minutes would prove whether her instincts were correct or whether she was about to embarrass herself by reporting a legitimate medical professional who was simply following protocols she wasn't aware of. Either way, Sarah knew she had made the right choice in prioritizing patient safety over her own comfort. As she waited for security to arrive, Sarah's mind raced through everything she had observed. The stranger's behavior, his unfamiliarity with standard protocols, and the fact that no one had informed her of scheduled medication adjustments all supported her suspicion that something was seriously wrong. The sound of approaching footsteps in the corridor signaled that help was on the way. Sarah's temporary status at the hospital had often made her feel like an outsider, but in this moment, her commitment to patient care and attention to detail might be the difference between life and death for Mr. Morrison and potentially other patients in the ward. What Sarah didn't yet know was that her observation skills and willingness to act on her instincts were about to uncover a threat that had been operating undetected in the hospital for weeks. The man she had spotted was not a healthcare worker at all, but someone with far more sinister intentions who had been systematically targeting vulnerable patients across multiple wards. The next few hours would transform Sarah from just another temporary nurse into the person whose vigilance had prevented a potential tragedy. Her status as an outsider, which had so often felt like a disadvantage, was about to become the very thing that allowed her to see what others had missed. Security Officer Marcus Johnson had been working at Metropolitan General Hospital for 8 years, and he could usually distinguish between genuine emergencies and false alarms within the first few seconds of arrival. When he received the call about an unauthorized person in the cardiac ICU, something in the caller's voice suggested this wasn't a case of mistaken identity or confusion about hospital protocols. Officer Johnson arrived at the ICU within 3 minutes of Sarah's call, accompanied by his partner, Officer Lisa Chun. They found Sarah positioned strategically near the nurse's station, maintaining visual contact with room 318 while appearing to perform routine duties. Her calm but alert demeanor immediately impressed both officers. I'm Officer Johnson. You called about an unauthorized individual. Sarah quickly but quietly briefed the officers on what she had observed. He's still in room 318 with Mr. Morrison. He claimed to be adjusting for medications, but I wasn't notified of any scheduled changes, and I don't recognize him as regular staff. Officer Chin moved to position herself near the main corridor exit while Johnson approached room 318. Through years of experience, they had developed a protocol for investigating potential security threats without causing unnecessary panic among patients or legitimate staff members. As Officer Johnson neared the room, the stranger emerged from Mr. Morrison's room carrying a small medical bag and clipboard. He was a middle-aged man with graying hair, wearing standard green scrubs and a hospital ID badge. To casual observers, he would have appeared completely normal, but Johnson's trained eye immediately noticed several inconsistencies. The man's scrubs were clean to the point of looking new, unlike the slightly worn appearance typical of clothing that had been through hospital laundry services multiple times. His shoes were expensive running sneakers rather than the practical, non-slip footwear most medical professionals preferred for long shifts. Most telling, his body language changed the moment he noticed the security officer approaching. "Excuse me, sir," Officer Johnson said in a calm but authoritative tone. "Could I see your identification and verify your business in this unit?" The man's initial response seemed rehearsed, as if he had prepared for this possibility. "Of course, officer. I'm Dr. Michael Stevens from the pharmacy department. I was conducting a routine medication audit. He reached for his ID badge with movements that seemed slightly too deliberate. Sarah watched the interaction from her position at the nurse's station, her heart pounding as she waited to see whether her instincts had been correct. Part of her hoped she was wrong. Discovering that she had caused unnecessary alarm would be embarrassing, but harmless. However, the stranger's nervous energy and the security officer's focused attention suggested that her concerns might be justified. Officer Johnson examined the ID badge carefully. While it looked legitimate at first glance, closer inspection revealed several subtle flaws. The photo quality was slightly different from standard hospital badges, and the magnetic strip on the back appeared newer than the rest of the card. Most importantly, the badge number didn't match the format used by Metropolitan General's current ID system. Dr. Stevens, I'm going to need to verify your credentials with the pharmacy department. Would you mind accompanying me to the security office while we sort this out? The man who called himself Dr. Stevens hesitated for just a moment too long before agreeing. Certainly, though I do have other patients to see this morning. Perhaps we could handle this quickly? As the group moved toward the elevator, Sarah noticed that Dr. Williams had arrived to begin her rounds. The attending physician looked concerned when she saw security officers escorting someone away from the ICU, and Sarah quickly approached to explain the situation. Doctor, I called security about that man. He was in Mr. Morrison's room claiming to adjust 4 medications, but I wasn't informed of any changes to his treatment plan. Dr. Williams immediately understood the implications. Show me exactly what he was doing. They entered room 318 together, where Mr. Morrison was resting peacefully, apparently unaware that anything unusual had occurred. Dr. Williams carefully examined his 4-line and the connected medication bags, looking for any signs of tampering or unauthorized additions. Mr. Morrison, how are you feeling right now? Any unusual sensations or changes since someone was here to check your medications? The patient seemed confused by the question. I feel fine, I think. The man said he was making sure my pain medication was working properly. Is something wrong? Dr. Williams and Sarah exchanged glances. Legitimate medication adjustments would require specific documentation and patient consent beyond routine procedures. The fact that the stranger had provided vague explanations to both the nursing staff and the patient raised serious red flags. We're just being extra careful, Dr. Williams assured Mr. Morrison while carefully examining the 4 insertion site. Sarah, I want full blood work on Mr. Morrison immediately, including a comprehensive drug screen. Something's not right here. Meanwhile, in the security office, Officer Johnson was discovering that Dr. Stevens was not who he claimed to be. The pharmacy department had no record of anyone by that name, and the badge number traced to a legitimate employee who was currently on vacation in another state. When confronted with this information, the man's carefully constructed facade began to crumble. I think there's been some confusion, he said, his voice taking on a different quality than the confident professional tone he had used earlier. Let me call my supervisor to clear this up. Officer Chun, who had been running background checks, looked up from her computer with an expression that made Johnson's blood run cold. Sir, we need to place you under arrest immediately. You match the description of someone we've been looking for in connection with several suspicious incidents at hospitals across the city. The man who had been calling himself Dr. Stevens suddenly dropped all pretense of cooperation. I want a lawyer. I'm not saying anything else. As officers placed him in handcuffs, Johnson radioed immediately for medical teams to examine every patient the suspect might have contacted. The scope of what they might be dealing with was starting to become clear, and time was critical for any victims who might have been affected. Back in the ICU, Sarah was coordinating with Dr. Williams to ensure Mr. Morrison's safety while also checking on other patients who might have been at risk. The blood work results would take time, but Dr. Williams decided to err on the side of caution and begin preliminary treatments to counteract potential poisoning. Sarah, I need you to document everything you observed, with precise times and descriptions. Your attention to detail may have prevented something catastrophic. As Sarah began writing her detailed report, she realized that her outsider status had actually been crucial to identifying the threat. Regular staff members might have assumed that someone in medical scrubs belonged in the unit, especially if he seemed to know basic protocols and carried proper equipment. Her unfamiliarity with the hospital's routine staff had made her more likely to notice someone who didn't fit the normal patterns. The investigation expanded rapidly as hospital administration realized the potential scope of the security breach. Detective Rachel Morrison from the city's Major Crimes Unit arrived within an hour to take over the case from hospital security. She immediately began interviewing staff members and reviewing security footage from the past several weeks. Ms. Martinez, walk me through exactly what made you suspicious of this individual, Detective Morrison said as she set up her recording equipment in a quiet conference room. Sarah recounted her observations methodically, starting with the man's unusual movement patterns through the ICU and ending with her decision to call security. Detective Morrison took careful notes, occasionally asking for clarification about timing or specific behaviors Sarah had noticed. You mentioned he seemed to be studying room numbers rather than heading directly to a patient. Can you elaborate on that? Most staff members know exactly where they're going when they enter a unit. They walk with purpose toward a specific room. This man was moving more slowly, almost like he was choosing which room to enter based on some criteria I couldn't understand. Detective Morrison nodded grimly. That's consistent with predatory behavior we've seen in other cases. Someone targeting vulnerable patients would need to assess which rooms contain the most suitable victims. The conversation was interrupted by Dr. Williams, who entered the conference room with a concerned expression. Detective, we have the preliminary blood work results for Mr. Morrison. He has elevated levels of potassium chloride in his system, levels that could have been fatal if they had continued to increase. Sarah felt her stomach drop as the full implications of what she had witnessed became clear. The stranger hadn't been conducting a routine medication check. He had been attempting to murder Mr. Morrison with an injection of potassium chloride, a substance that could cause cardiac arrest when administered in sufficient quantities. How long before the levels would have become dangerous? Detective Morrison asked. Based on the concentration we found, probably another 15 to 20 minutes. Sarah's intervention quite literally saved this man's life. The gravity of the situation settled over the room like a heavy blanket. Sarah had prevented a murder through nothing more than careful observation and willingness to trust her instincts. If she had hesitated or convinced herself that she was overreacting, Mr. Morrison would likely be dead. Detective Morrison continued her investigation by reviewing security footage from the past month. What she discovered was deeply disturbing. The man they had arrested had been appearing at the hospital sporadically for at least 3 weeks, always during busy periods when his presence was less likely to be questioned. He's been casing the hospital, Detective Morrison explained to Sarah and Dr. Williams as they reviewed the footage together. Look at this. 3 weeks ago, he spent an hour walking through different wards, observing routines, and identifying security vulnerabilities. The footage showed the suspect moving through various departments, always appearing professional and purposeful to casual observers. However, when viewed chronologically, a clear pattern emerged of someone systematically studying the hospital's operations and identifying opportunities to access vulnerable patients. Why wasn't this noticed earlier? Dr. Williams asked, though she suspected she already knew the answer. Because he was good at blending in, and because hospital staff are accustomed to seeing unfamiliar faces regularly. Temporary staff, specialists from other departments, visiting consultants. There are legitimate reasons for people to be in areas where they're not immediately recognized. Sarah realized with a chill that the suspect's success had partly depended on the very environment that had made her own temporary status feel so isolating. Hospitals were places where people moved between departments regularly, where shifts changed frequently, and where the pace of activity often prevented staff from questioning every unfamiliar face. The investigation revealed that the suspect, whose real name was Thomas Kellner, had been impersonating medical professionals for months. He had been caught attempting similar crimes at 2 other hospitals in the region, but had managed to escape before being arrested. His method was always the same: target vulnerable patients in intensive care units and attempt to inject them with substances that would cause apparently natural deaths. What made you choose Mr. Morrison's room? Detective Morrison asked Kellner during his interrogation, though she didn't expect a helpful response. Kellner's lawyer had advised him not to answer specific questions, but his psychological evaluation would later reveal a disturbing pattern of behavior targeting patients who were already facing serious health challenges. He seemed to derive satisfaction from the idea that his victims' deaths would be attributed to their existing medical conditions rather than foul play. As news of the arrests spread through the hospital, Sarah found herself receiving recognition that felt both gratifying and overwhelming. Hospital administration praised her vigilance and announced new security protocols based partly on her recommendations. Dr. Williams made it clear that she would provide strong references for any permanent position Sarah might seek. However, the experience had also made Sarah acutely aware of the vulnerabilities that existed in healthcare settings. The same factors that made hospitals efficient and accessible, the need for rapid movement between units, the presence of many different specialists, the trust placed in people wearing medical attire, also created opportunities for those with malicious intent. The most unsettling aspect of the entire incident was how close Kellner had come to succeeding. If Sarah had been less observant, if she had convinced herself that her concerns were unfounded, or if she had hesitated just a few minutes longer before calling security, Mr. Morrison would have died in what appeared to be a medical complication. As the day's shift continued, Sarah found herself hyper-aware of every unfamiliar face and unusual activity in the ICU. The confidence she had felt in her professional abilities was now mixed with the sobering knowledge of how much harm could be done when safety protocols failed or when dangerous individuals exploited the trust inherent in medical settings. The revelation about Thomas Kellner's true identity and criminal intent sent shockwaves throughout Metropolitan General Hospital and the wider medical community. As Detective Morrison's investigation deepened, the scope of Kellner's activities became increasingly disturbing, and Sarah found herself at the center of what was becoming a major criminal case. 3 days after Kellner's arrest, Detective Morrison called Sarah into the police station to review additional evidence that had emerged. The detective had been working around the clock, coordinating with law enforcement agencies across multiple states to piece together the full extent of Kellner's crimes. Ms. Martinez, what I'm about to show you is confidential information that will eventually be presented in court, Detective Morrison said as she opened a thick file folder. We've identified at least 7 other hospitals where Kellner had been operating under various false identities. Sarah studied the photographs and documents spread across the table. Each showed the same man wearing different disguises and using different names: Dr. Michael Stevens, Dr. Robert Chun, pharmacy technician James Wilson, and several others. The false identities were sophisticated, complete with fake credentials and backstories that had allowed him to gain access to secure medical facilities. How did he create such convincing false identities? We're still investigating that, but it appears he had help from someone with access to medical credentialing systems. The fake ID badges weren't homemade. They were professionally produced using stolen templates and equipment. Detective Morrison showed Sarah a map marked with locations where Kellner had struck before. The pattern was chilling. He had been systematically moving through the region's hospitals, never staying in one place long enough to establish suspicions, always targeting patients who were already critically ill. We believe he was responsible for at least 12 suspicious deaths over the past 8 months, Detective Morrison continued. In each case, patients who were expected to recover from their conditions suddenly experienced cardiac events that appeared consistent with their underlying medical problems. Sarah felt sick as she realized how many lives had been lost before her intervention. 12 families had lost loved ones to what they believed were medical complications, never knowing that their relatives had been murdered by someone exploiting their trust in the healthcare system. Why did he do it? What was his motivation? Detective Morrison pulled out a psychological evaluation report. According to Dr. Patricia Hendricks, the forensic psychologist who interviewed him, Kellner appears to have a complex set of motivations. He was a failed medical student who was expelled from nursing school 15 years ago for academic dishonesty and inappropriate behavior toward patients. The profile painted a picture of someone who had harbored resentment against the medical profession for years after his expulsion. Kellner had attempted to rebuild his life in various careers, but had consistently failed to achieve the respect and status he felt he deserved. His attacks on vulnerable patients seemed to be both revenge against the medical system that had rejected him and an attempt to demonstrate what he saw as his power over life and death. He told Dr. Hendricks that he enjoyed the idea that doctors and nurses would never suspect that their patients were being murdered right under their noses. He saw it as proof of his intelligence and their incompetence. Sarah shuddered at the calculated cruelty behind Kellner's actions. The man she had encountered in Mr. Morrison's room hadn't been acting on impulse or in a moment of mental breakdown. He had been executing a carefully planned attack on people who were already suffering and vulnerable. Detective Morrison continued reviewing the evidence, showing Sarah how Kellner had been refining his techniques over time. His early attempts had been more crude and risky, but he had learned from each incident to become more sophisticated in his approach. Your intervention was crucial not just because you saved Mr. Morrison's life, but because you broke the pattern. Kellner was becoming more confident and more dangerous with each successful attack. The investigation had revealed that Kellner had been planning to escalate his activities significantly. Police had found detailed maps of hospitals throughout the region in his apartment, along with notes about security procedures and staff schedules. He had been preparing for what appeared to be a much larger series of attacks. We found evidence that he was planning to target pediatric wards next, Detective Morrison said grimly. He had been researching children's hospitals and had already begun creating new false identities specifically for accessing those facilities. The thought of Kellner targeting sick children filled Sarah with a rage she had never experienced. Her decision to trust her instincts and call security had prevented not just Mr. Morrison's death, but potentially dozens of future victims, including vulnerable children. Back at Metropolitan General Hospital, the administration had implemented sweeping security reforms in response to the incident. Hospital Chief Executive Officer Dr. Margaret Foster called a meeting with all department heads to address the changes and their implications for daily operations. The security breach we experienced has exposed vulnerabilities that exist throughout our facility and likely throughout the healthcare system more broadly, Dr. Foster began. We are implementing immediate changes to prevent this type of incident from occurring again. The new protocols included mandatory verification of all personnel entering patient care areas, enhanced background checks for temporary staff, and a buddy system that required unfamiliar individuals to be accompanied by verified employees when accessing sensitive areas. Additionally, all staff members would receive training in recognizing and reporting suspicious behavior. Sarah attended the meeting as a representative of temporary nursing staff, a role that would have been unthinkable just a week earlier. Hospital administration had specifically requested her input on improving security measures based on her unique perspective as someone who moved between facilities regularly. Ms. Martinez, from your experience working in multiple hospitals, what security weaknesses do you think are most commonly overlooked? Dr. Foster asked. Sarah had given considerable thought to this question since Kellner's arrest. The main issue is that medical facilities prioritize accessibility and efficiency, which can conflict with security needs. People in medical attire are assumed to belong, and there's often pressure to avoid delays that might interfere with patient care. She explained how Kellner had exploited the very qualities that made hospitals effective: the trust placed in medical professionals, the fast pace that discouraged detailed verification of credentials, and the assumption that people who knew basic medical terminology and procedures must be legitimate healthcare workers. I think the solution is to create verification systems that don't slow down emergency care, but do catch people who shouldn't be there. For example, requiring all staff to verify their identity when accessing patient floors, even if they're wearing appropriate clothing. Dr. Williams, who had become one of Sarah's strongest advocates, supported her suggestions with enthusiasm. Sarah's observations saved a life and potentially prevented many more deaths. I think we need to listen carefully to her recommendations. The meeting resulted in the adoption of several security measures that Sarah had proposed, including a system for temporary staff to be formally introduced to permanent employees at the beginning of each shift and regular verification of anyone performing procedures that weren't part of routine scheduled care. As the investigation continued, Sarah found herself becoming something of a celebrity within the hospital system. News media had picked up the story of the temporary nurse who had exposed a serial killer, and she was receiving interview requests from reporters across the region. Hospital administration encouraged her to speak publicly about the importance of vigilance and trust in professional instincts. However, Sarah was struggling with the emotional impact of everything that had transpired. Knowing that she had prevented Mr. Morrison's murder was gratifying, but learning about Kellner's other victims had left her with deep feelings of guilt and sadness. She couldn't stop thinking about the patients who had died before she happened to be in the right place at the right time. Dr. Williams noticed Sarah's distress and arranged for her to speak with Dr. Jennifer Hayes, a counselor who specialized in helping healthcare workers process traumatic experiences. The counseling sessions helped Sarah understand that her feelings of guilt were normal but misplaced. She bore no responsibility for Kellner's previous crimes. "You did exactly what you were supposed to do when faced with suspicious activity," Dr. Hayes explained during one of their sessions. "The fact that other patients died before you encountered this individual doesn't diminish the importance of your actions or make you responsible for their deaths." The counseling also helped Sarah process the broader implications of what had happened for her career and her sense of security in healthcare settings. She had always taken pride in her work, but the incident had made her acutely aware of how much trust patients placed in medical professionals and how devastating it was when that trust was betrayed. "I keep thinking about how Mr. Morrison trusted Kellner completely because he was wearing scrubs and seemed to know what he was doing," Sarah told Dr. Hayes. "Patients are so vulnerable when they're sick, and they have to trust that everyone caring for them has their best interests at heart." Dr. Hayes helped Sarah understand that this vulnerability was both the greatest challenge and the greatest responsibility of healthcare work. The trust patients placed in medical professionals was sacred, and professionals like Sarah, who took that trust seriously, were essential to maintaining the integrity of the healthcare system. As news of Kellner's arrest spread, other hospitals began reviewing their own security incidents and suspicious deaths. Several facilities discovered patterns they had previously attributed to natural causes, but now recognized as potentially criminal activity. The investigation was expanding far beyond what anyone had initially imagined. Detective Morrison contacted Sarah again 2 weeks after Kellner's arrest with additional developments in the case. "We've identified 3 more hospitals where Kellner was active, and we're reviewing patient deaths that occurred during his visits. Your intervention may have exposed a serial killer who had been operating undetected for longer than we initially thought." The investigation had revealed that Kellner's activities weren't random. He had been specifically targeting hospitals with high patient turnover and understaffed units where his presence was less likely to be noticed or questioned. His selection of victims had also followed a pattern, focusing on patients who were already seriously ill but whose conditions were not immediately life-threatening. He was counting on the fact that cardiac events in ICU patients wouldn't be thoroughly investigated, Detective Morrison explained. "If someone dies of apparent heart failure while recovering from surgery or a heart attack, it's usually attributed to complications from their existing condition." This calculated approach made Kellner's crimes even more disturbing. He hadn't been acting on impulse or targeting random victims. He had been systematically identifying vulnerable patients and exploiting both their medical conditions and the trust of their caregivers to commit murder. The scope of the investigation was now involving federal agencies, as evidence suggested that Kellner had been traveling across state lines to commit his crimes. The FBI had assigned special agents to coordinate with local law enforcement and hospital security teams to identify all of his activities and potential victims. Sarah received word that she would be called to testify when Kellner's case went to trial. The prospect of facing him in court was intimidating, but she was determined to ensure that he was held accountable for his crimes and that her testimony might help provide closure for the families of his victims. The transformation in Sarah's professional status had been remarkable. What began as just another temporary nursing assignment had evolved into a career-defining moment that had earned her recognition throughout the medical community. Several hospitals had offered her permanent positions, and she was being courted by facilities across the region who wanted to benefit from her attention to detail and commitment to patient safety. However, Sarah realized that the incident had changed her in ways that went beyond professional recognition. She had always taken her responsibilities as a nurse seriously, but now she understood more deeply how crucial vigilance and trust in professional instincts could be in protecting vulnerable patients from those who would exploit their suffering. 6 months after Thomas Kellner's arrest, Sarah Martinez stood before a packed courtroom as the prosecution's star witness in what had become one of the most significant healthcare security cases in the region's history. The investigation had ultimately revealed that Kellner was responsible for 17 confirmed murders and was suspected in 12 additional deaths across 8 hospitals over a period of 14 months. Sarah's testimony was crucial because she was the only person who had directly observed Kellner attempting to harm a patient and had taken action to prevent it. Her detailed observations and the meticulous notes she had taken during that morning at Metropolitan General Hospital provided the prosecution with clear evidence of Kellner's methods and intent. Ms. Martinez, the prosecutor began, please tell the court what first made you suspicious of the defendant on the morning of October 15th. Sarah took a deep breath and began recounting the events that had changed her life and saved Mr. Morrison's life. She described Kellner's unusual movement patterns through the ICU, his lack of familiarity with standard protocols, and, most importantly, her decision to trust her professional instincts despite her temporary status at the hospital. I had worked in enough hospitals to know how medical professionals typically behave when they have legitimate business in a patient's room. The defendant's actions didn't match those patterns, and when he claimed to be adjusting medications without proper documentation or notification, I knew something was seriously wrong. The defense attorney attempted to challenge Sarah's credibility by emphasizing her temporary status and suggesting that her unfamiliarity with Metropolitan General's specific procedures had led to misunderstanding rather than genuine suspicious activity. However, Sarah's calm, detailed responses and the overwhelming physical evidence against Kellner made these attacks ineffective. Ms. Martinez, isn't it possible that as a temporary employee, you simply weren't informed of all the procedures and protocols at this particular hospital? The defense attorney pressed. No, Sarah replied firmly. Medication adjustments for ICU patients require specific documentation and verification regardless of which hospital you're working in. These are universal safety protocols designed to prevent exactly the kind of harm the defendant was attempting to cause. Dr. Williams, who had also testified earlier in the trial, had provided expert testimony about the potassium chloride found in Mr. Morrison's bloodstream and how close he had come to death. Her testimony made it clear that without Sarah's intervention, Mr. Morrison would have died within minutes of Kellner's injection. The trial also featured testimony from family members of Kellner's confirmed victims. These heartbreaking accounts highlighted the devastating impact of his crimes on families who had lost loved ones they believed died from natural causes. Many families described how they had been grateful for what they thought was their relatives' peaceful deaths, never imagining that their loved ones had been murdered. Margaret Thompson, the daughter of one of Kellner's victims, addressed the court with a statement that brought many observers to tears. My mother went into the hospital for routine surgery and was recovering well. We thought her sudden cardiac event was just one of those tragic complications that sometimes happen. Learning that she was actually murdered by someone we trusted to help her has destroyed our faith in the medical system. These victim impact statements underscored the broader implications of Kellner's crimes. Beyond the individual tragedies, his actions had undermined public trust in healthcare institutions and highlighted vulnerabilities that affected patient safety throughout the medical system. The jury deliberated for less than 2 hours before returning guilty verdicts on all counts. Kellner was sentenced to life in prison without the possibility of parole, a sentence that reflected both the severity of his crimes and the court's recognition that he posed an ongoing threat to society. Following the trial, Sarah found herself in a unique position within the healthcare community. Her experience had made her one of the leading voices advocating for improved security protocols in medical facilities. She had accepted a permanent position as Director of Patient Safety at Metropolitan General Hospital, a newly created role that reflected the hospital's commitment to preventing future security breaches. In her new position, Sarah worked to implement comprehensive security reforms that balanced patient care needs with safety requirements. The protocols she developed were being adopted by hospitals throughout the region and had attracted attention from healthcare administrators nationwide. The key is creating systems that enhance security without interfering with medical care, Sarah explained to a conference of hospital administrators 6 months after the trial. We need to verify that people belong where they are without creating barriers that could delay emergency treatment. One of Sarah's most significant contributions was the development of a training program that helped medical staff recognize suspicious behavior while avoiding the kind of complacency that had allowed Kellner to operate undetected for so long. The program emphasized that security was everyone's responsibility, not just the job of dedicated security personnel. Healthcare workers are naturally trusting because our work requires collaboration and quick decision-making, Sarah told the healthcare conference audience. But we need to balance that trust with awareness that people with malicious intent specifically target our trusting nature. The training program included case studies based on Kellner's activities and other security incidents, showing healthcare workers how to identify behavioral patterns that might indicate criminal intent. It also emphasized the importance of verifying credentials and procedures, even when doing so might seem inconvenient or awkward. Sarah's work had attracted attention beyond the healthcare community. She had been invited to speak at law enforcement conferences about healthcare security and had consulted with federal agencies developing guidelines for hospital security protocols. Her unique perspective as someone who had actually confronted a healthcare predator made her insights particularly valuable. The experience had also led Sarah to pursue additional education in healthcare administration and security. She was completing a master's degree in healthcare management while working full-time, preparing herself for even greater responsibilities in improving patient safety and security. However, the most meaningful aspect of Sarah's new role was the direct contact she maintained with patients and their families. She regularly visited patient care areas to observe security protocols and talk with patients about their concerns and experiences. These interactions reminded her daily of why her work was important. During one of these visits, Sarah encountered Mrs. Eleanor Thompson, the elderly woman whose breathing patterns had concerned her on the same morning she had discovered Kellner. Mrs. Thompson had recovered fully from her cardiac event and was back at the hospital for a routine follow-up appointment. "Sarah, dear, I heard about everything that happened after I was discharged. You're the nurse who caught that terrible man, aren't you?" Sarah was touched that Mrs. Thompson remembered her despite everything that had occurred. "I was just doing my job, Mrs. Thompson. How are you feeling?" "I'm doing wonderfully, thanks to nurses like you who pay attention to the little things. You know, that morning you seemed concerned about my breathing, even though all my numbers were normal. Turned out I was developing pneumonia, and catching it early made all the difference in my recovery." This conversation reminded Sarah that her attention to detail and willingness to trust her instincts had benefits beyond the dramatic intervention that had caught Kellner. Good nursing care was often about noticing subtle changes and patterns that might seem insignificant but could indicate developing problems. The broader impact of Sarah's actions continued to unfold throughout the healthcare community. The case had prompted federal legislation requiring enhanced background checks for anyone with access to patient care areas and had led to the development of national standards for hospital security protocols. Dr. Patricia Foster, the CEO of Metropolitan General Hospital, had become a strong advocate for the security reforms that emerged from the Kellner case. Sarah Martinez didn't just save one patient's life, Dr. Foster told a national healthcare conference. Her vigilance and courage exposed vulnerabilities that existed throughout our industry and sparked changes that are protecting patients everywhere. The financial impact of improved security measures was significant, but hospitals discovered that the investment was worthwhile not only for patient safety but also for reducing liability and maintaining public trust. Insurance companies began offering reduced premiums for facilities that implemented comprehensive security protocols based on the standards Sarah had helped develop. 1 year after Kellner's arrest, Sarah was honored by the American Nurses Association with their highest award for patient advocacy. The ceremony, attended by healthcare professionals from across the country, recognized her role in exposing a serial killer and improving security for vulnerable patients everywhere. "Sarah Martinez represents the best of our profession," said the ANA president during the award ceremony. Her commitment to patient safety, her willingness to trust her professional instincts, and her courage in acting on her concerns exemplify the values that define excellent nursing care. In her acceptance speech, Sarah emphasized that the real heroes were the countless healthcare workers who provided compassionate, vigilant care every day without recognition. "I was in the right place at the right time, but every nurse, every doctor, every healthcare worker has opportunities to protect patients by staying alert and trusting their instincts. The speech also highlighted the importance of supporting temporary and traveling healthcare workers, who often face challenges in being accepted and heard within healthcare institutions. Organizations need to create environments where all staff members feel comfortable raising concerns, regardless of their employment status or how long they've been at a particular facility. As Sarah looked toward the future, she was planning to expand her patient safety work beyond Metropolitan General Hospital. She had been offered positions with consulting firms that specialized in healthcare security and had received inquiries from government agencies interested in her expertise. However, she was also considering a different path, returning to direct patient care while maintaining her advocacy work. The experience with Kellner had reminded her why she became a nurse in the first place, to provide compassionate care to people during their most vulnerable moments. The administrative work is important and rewarding, Sarah confided to Dr. Williams during one of their regular meetings. But sometimes I miss being at the bedside, taking care of patients directly. Dr. Williams understood this sentiment completely. Maybe there's a way to combine both roles. Patients need advocates at every level, at the bedside, in administration, and in policy development. Your experience gives you credibility in all those areas. The conversation led Sarah to develop a new career plan that would allow her to split her time between direct patient care and safety administration. Metropolitan General Hospital supported this approach, recognizing that Sarah's ongoing connection to bedside nursing would enhance her effectiveness as a safety advocate. 5 years after the incident that changed her life, Sarah Martinez had become a nationally recognized expert in healthcare security while maintaining her commitment to direct patient care. The temporary nurse who had once felt like an outsider had found her calling as someone who bridged the gap between frontline healthcare workers and administrative leadership. The case of Thomas Kellner continued to serve as a cautionary tale and teaching tool for healthcare institutions throughout the country. Sarah's story was featured in nursing school curricula and hospital orientation programs as an example of how individual vigilance and courage could protect vulnerable patients from those who would exploit their trust. Most importantly, the security protocols and training programs that emerged from Sarah's intervention had prevented numerous other potential incidents. While the full impact would never be completely measurable, healthcare security experts estimated that the changes sparked by the Kellner case had saved hundreds of lives by preventing other predators from accessing vulnerable patients. Sarah often reflected on how different things might have been if she had dismissed her concerns or convinced herself that she was overreacting. Her willingness to act on her professional instincts, despite her temporary status and fear of embarrassment, had not only saved Mr. Morrison's life, but had also exposed a serial killer and sparked reforms that protected patients throughout the healthcare system. The experience had taught her that being an outsider could sometimes be an advantage, providing perspective that insiders might miss. Her temporary status, which had once felt like a weakness, had actually been crucial to recognizing threats that others had overlooked. As she continued her work protecting patients and training healthcare workers, Sarah carried with her the knowledge that vigilance and courage could make the difference between life and death for vulnerable people who depended on the healthcare system for their survival. Her story served as a reminder that extraordinary heroism often emerged from ordinary people doing their jobs with exceptional care and attention.